uses our collagen product. Yay. Yeah. So that product I started using spontaneously. So I was in the dressing room with my daughter, trying on bathing suits, and I was self-deprecating and looking at my cellulite, which I'm thin and have cellulite. It's no prettier than you guys who have muscle behind it, you know. And I was like, she's like, Mommy, it doesn't matter, you know, your cellulite is like all the mommies. And I was like, okay. And so I was like, there's got to be something. So I, of course, Dr. Type A, do this, Google. I go to our Dr. Google is called PubMed, which you all played with yesterday. So I go to PubMed and I start looking. And I find these randomized controlled studies, which is like the thing that you want, looking at this specific collagen I'd never heard of before called Verisol, and that they just measured wrinkles and cellulite with like laser, like the way the dermatologists do it, and they saw improvement. And I was like, well, it's not going to hurt me, and it's a decent source of protein. Where can I find this? Then I Google Verisol collagen, and I find this company Sparkle, and I start using it, and I love it. Okay, my hair gets a little better. Does the cellulite get better? I don't know, but I just don't look back there anymore. It's fine. So but I noticed my skin, like people were complimenting me. And then, of course, on social, I start talking about it. And the owner of the company is like, please tell me when you're going to mention this because we're running out. And so through the years, he and I developed a partnership. And we basically co-branded the collagen for Galveston Diet, and then which is now the Pause Nutrition. And so I love the product. So lo and behold, a new collagen comes into town that had some pretty exciting data. So if you guys have learned nothing in the last day, we have an epidemic of osteopenia and osteoporosis, and it is worth the investment if your insurance won't cover it to go pay the $99 and go get a DEXA scan, because you don't want to find out you're osteoporotic after you fracture. You want to know if you're at risk, and the best way to do that is with a DEXA. And then all the things that Dr. Wright talked about, all the things we're talking about, okay? It's preventable. It's preventable. You don't have to fall and fracture. We can avoid a lot of this with the right toolkit, okay? So, the data is kind of all over the place. 30% of all women are osteoporotic. But 50% of women will have an osteoporotic fracture before they die. Now, it may not be their hip, which is the one, that will kill you. It might be your wrist, it might be your knee. And the thing that's going to predict the risk of you fracturing the most is a fracture. Okay, so if you've broken things, more than likely you're going to fall. We're all going to fall. It's going to happen. Okay. So why do we have this epidemic? It's always multi-system. There's not one thing. Well, we're women. Okay. And the drugs to treat osteoporosis, osteopenia are really poorly tolerated. Is anybody having a wonderful time on them right now, or having an easy course? Please share your experience, because I struggle with my patients being able to find one that they're going to tolerate. HRT is underutilized. I mean, that's the core mission of, so many of the companies around this, is to get HRT. I'm just trying to slap an estrogen patch on every single woman who can tolerate it, And so, and guess what? Calcium supplements don't work. They've never been shown to decrease the risk of osteoporotic fracture. All they do is increase your risk of a kidney stone, and the cardiologists hate it because they feel that it is increasing the risk of calcifying those plaques that are lining our arteries. Okay? You should get your calcium from food. Low calcium diets, meaning diets not rich in calcium, you are at higher risk for osteoporosis, right? But just backing that up with supplements are not better than food. And so the calcium supplements your doctor's telling you to choke down, stop, okay? Look at your diet, track what you're eating, see how much calcium you're getting naturally in your diet, and fight. Welcome, absolutely welcome. Please come in. It's our new friend. Hi. So, okay, so try to get your calcium from food, maybe a little supplementation to get you over the edge, but the 1,200 milligrams of calcium a day, it's just going to make you constipated and you're still going to break. Okay. Wouldn't it be great if we had an easy, tolerated product that we could take that tastes good and worked? So this study came out in 2021. I like my receipts. I love evidence. And I was so excited about it. So it came out in the Journal of Bone Metabolism in 2021, specific bioactive collagen peptides in osteopenia and osteoporosis, a long-time observation in postmenopausal women. It was not controlled because we don't really need controls. We know what women's bones are going to do when we leave them alone. Okay. We don't give them HRT and we don't give them bone strengthening medications and they don't work out and they don't, do the things. So it was a very small study, 31 women, but they followed them for 4 years. They had osteopenia or osteoporosis at the time of diagnosis. They excluded women with serious chronic disease, and they excluded women who had been on any bone building medication in the last year. Okay, pretty good data. All right, so here's what they found. I'm going to come over to this one. All right, so spine is on the top. So they originally were going to do it a controlled study, but so many women fell out. They only had 31. So they had 2 groups, and the average age was 62 years old. Okay, and the starting point was back here, and then they with osteopenia, osteoporosis, and then they have 1 year, 2nd year, 3rd year, 4th year. The gray at the bottom, that's what bones do. We have that data. We know what your bones are going to do every year if you don't do the things, right? So that's what happens. These women took 5 grams of this bioactive collagen every day for 4 years, had no other interventions that we know of, and those top lines are what they did. Statistically significant increase in bone strength in the spine and the femur. Now, it took a while to reach significance, but it takes a while for us to grow our bones back, all right? So it's called Fortibone. And I thought, I want this. I want to do this, And so I already had the skin product, but I want a bone product. And I want to put them together. And I'm going to call it Skin and Bones.